Thank you, Val. Hello, everybody, and welcome to today's call on the Executive Training Program, EXTRA. Today we will be talking about the 2016 and 2017 EXTRA program. As Val mentioned, I'm Erin Leith, the Director of Education and Training at the Canadian Foundation for Healthcare Improvement, and I'm pleased to be your host. We are also pleased to provide simultaneous interpretation on today's call. For this reason, you may notice a slight delay in the audio at points through the duration of the call, and we will invite you to participate in the chat box discussions today in your language of choosing. As I introduce our speakers, I'll ask that you please take a moment to introduce yourselves in the chat box, who you are, where you're from, as well as any questions you may have for today's speakers. First, I would like to introduce Martine Couture. Martine has been the Chief Executive Officer of the Centre d'Intégré de Universitaire de Santé et de Services Sociaux at the Saguenay-Lac-Saint-Jean since April of 2015. Martine was from the EXTRA Cohort 10, and her team project focused on the regionalization and implementation of a chronic disease management model. Also joining the call today is Lynn Edwards. Lynn is an EXTRA Fellow from Cohort 7 and is the Senior Director of Primary Healthcare and Chronic Disease Management at the Nova Scotia Health Authority. Lynn and her team focused on the integration of, or rather interorganizational relationships and the effective teamwork to help support healthcare improvement in Nova Scotia. Also in the studio today are our producers, Kelly Ripley and Sheena Powell, who will make sure that our call goes exceptionally smoothly today. On today's call, we are going to begin with an introduction to the EXTRA program, including an overview of the program's objectives, its core components, key activities, and deadlines. We'll also hear from Martine and Lynn about their past personal experience in the program, including how it has really impacted the organizational capacity to lead improvement, develop their own leadership skill sets, and influence their careers. For those who may not be as familiar with CFHI, we are a not-for-profit federally funded healthcare improvement organization, and we aspire to deliver demonstrable results for Canadians by improving patient and family experience of care, population health, and value for money. CFHI identifies proven innovations and accelerates their spread across Canada by supporting healthcare organizations to adapt, implement, and measure improvement in patients' care, population health, and value for money. We do this by working with improvement teams and organizations from across all jurisdictions who will come together on common improvement priorities and provide opportunities to lead, share, implement evidence-informed solutions across regions, provinces, and territories. So a little bit about what we do. These four bubbles really capture it in a nutshell. We enhance organizational capacity to champion and lead improvement, and we do that across all of our programs. We also catalyze healthcare innovation by involving those with experience and the need for care as experts in improvement and co-design. We use improvement methods and tools to deliver measurable results toward better care for patients' health and value, and we bring together coalitions of the willing to support these networks and change agents to implement improvement across Canada. So EXTRA has made a tremendous impact in the landscape of healthcare improvement in Canada. As you can see on the slide, we have more than 300 healthcare professionals having participated in the program and now have a joint network of incredible fellows, EXTRA fellows across the country. Over 120 organizations have participated, leading more than 200 improvement projects over the last 11 years. So we're really proud to be now inviting calls and applications to our 12th cohort of EXTRA. The EXTRA program is a 14-month, fully bilingual improvement fellowship, truly the only one of its kind in Canada. And it really has a three-part approach in terms of its objectives, and that is to build the organizational capacity to achieve and sustain improvement, to enhance the capacity of teams and leaders to accelerate that improvement, and to create that pan-Canadian community of leaders from across the country leading healthcare improvement together. This slide gives a nice visual representation of the types of improvements, benefits of working with CFHI and being involved in the extra program. So, moving a little honeycomb by honeycomb, you'll see that the program is oriented around one or more organizations participate together to put forward an application. They nominate a team of 3 to 4 existing or emerging leaders to work collaboratively on an improvement project that's of a priority to the organization. As I've mentioned, it's 14 months, it's fully bilingual, and it's led by expert faculty, both Canadian faculty as well as from international, as well as senior health system leaders who work as coaches with each and every improvement team. There are 4 learning modules delivered over the course of 14 months, and including 3 in-person residency sessions as e-based, as well as e-based learning through webinar and online learning modules. And participants of the extra program also have access to the CFHI online learning platform, soon to be re-released as My CFHI. So to give you some insight into the improvement project, you'll hear more from Lynn and Martine about their specific improvement work and the impact it's had. But the 300 plus projects have really spanned the full range of the quality domains in healthcare. So we do see that many of our improvement projects tackle the fundamental issues that you see before you on the screen, including patient and family-centered care and partnerships in care, safety, equity, efficiency, population health, health outcomes, and accessibility. And new in 2016 and 17, we actually have a special theme on and are inviting teams who may be interested in focusing on palliative care. In terms of the improvement project itself, so the application process is very much organized around identifying the right organization, the right improvement focal point, and then assembling a team around that improvement project. And the improvement project is truly the vehicle by which teams lead improvement in their organization, but it also is the way in which the participants and the fellows have the chance to implement their improvement work while they're learning the competencies identified through extra. So the IP should align with the organization's strategic priorities, quality and performance improvement goals and plans, as well as team members' responsibilities. The team members really do need to have that leadership capacity for change and the ability to foster a culture of improvement with their organization. So it's really critical in terms of the application that the right team is assembled and that they have the authority and the ability to lead and make change within their organization. As I mentioned earlier, there are 4 learning modules, and you'll see that those are on the screen before you. We start off with building organizational and team readiness. So you've already come into the extra program through your application phase, and you've identified what your project and your priority might be. And then we start to guide you through the development of your capacity and by competency through these 4 modules, starting with the building of that organizational and team readiness, and making sure that the IP, now you're working with the CFHI staff, faculty, and coaches to make sure that your improvement project is truly identified, precise, and achievable within the time frame. The Module 2 focuses on enhancing that leadership capacity that already exists, and we're really making sure that you're refining that IP and that it's well articulated, and that you're starting to get ramped up for Module 3 where you're actually implementing that change and starting to really think fully through the evaluation of the implementation. And then in the 4th module, we end on lessons learned and what might be possible in terms of the sustainability of that improvement and or its scale and spread. If it's showing great promise, we really want to support organizations in their ability not only to lead good pilot projects, but also to expand that out into system and organizational level change. You have before you a timeline for extra in terms of the participation in the program. So you'll see on the timeline at the bottom, there are 14 months of active involvement in the program itself, and we've outlined there the rollout of the modules and the deliverables along the top. There is teams will be identified and selected in March, and then they'll begin with an orientation webinar to the program in April of 2016. They'll go through the entire program. There'll be lots of interaction and opportunity to engage both virtually as well as in face-to-face meetings with CFHI staff, faculty, and coaches. And then the last 2 months in 2017 are spent putting together your final deliverables and submitting before you receive your diploma to the program. So I'll emphasize the key date here on the screen is the application deadline, which is February 15th, 2016. So in terms of who should apply, this is really an organizational commitment. So we are looking to organizations to put forward applications to apply to Extra. And this year, in this cohort, we're seeking up to 10 high-performing teams from one or more organizations. And on the screen before you, you see some instances of the types of organizations that have historically been involved in the program to date, but it absolutely can be from the policy realm and ministries of health, health authorities, healthcare delivery organizations, as well as smaller health improvement organizations at the primary healthcare, public health, community level. And we do encourage partnerships. Thank you. In terms of the cohort selection, I will encourage you to have a look at CFHI, the CFHI assessment tool. It's a tool freely available and downloadable from the CFHI website, and it really helps healthcare leaders to assess their organization's readiness and the system capacity to undertake improvement initiative. I find it personally a very helpful tool to better understand your organizational readiness and gives some very excellent insights that will help you in the development of your application. In terms of the actual selection process, Extra has an expert advisory committee which will assemble and review, conduct a merit review panel and review the applications, as I mentioned, in March. And they will really be looking at the applications against 3 levels: organization, team member appropriateness, and the appropriateness and feasibility of the improvement project. Is it doable within the time frame that's allotted? So I encourage you, there is more detail on the cohort selection criteria articulated in the prospectus. As I mentioned already, organizations are encouraged to partner together. So the application to the Extra program is put forward by organizations, but there are 3 to 4 members, and those 3 to 4 members who participate can be from 3 to 4 organizations. So we encourage larger health system organizations to work together with smaller health service delivery organizations and whatnot, and partnerships are absolutely encouraged. There is a one-time fee of $30,000 to participate in the program, and this fee covers 3 to 4 team members' participation in the program, access to the online learning environment, faculty, coaching support, but that participating organizations are also responsible to cover team members' travel costs and attend the 3 in-person residency sessions. And as I mentioned, this partnership is an opportunity for cost sharing. I will say that CFHI does significantly subsidize the cost of the program, so this is really a small fee in terms of offsetting the cost of the program, but ultimately we know that for many organizations that can be a $30,000 price tag. For a small organization can be challenging, which is why we're encouraging that partnership and the cost-sharing approach. Okay, so now I would like to pass the floor over to Martine. Just a reminder to our English-speaking audience that you will be hearing the voice of our translator, Corinne, and as such you may hear a very slight delay. So please go ahead, Martine.
Good afternoon. I'm very happy to be with you today, and I tried to summarize my Extra experience based on the questions that were addressed to me. So as you can see, the impact of Extra on my organizational culture, here we are, I'm sorry, I had the wrong slide. Now we're on the right slide. So the impact of Extra on the organizational culture here in our institution, to begin with, the healthcare system in Quebec went through major reform in April 2015. At the time when I was a fellow, I was already the CEO of an agency, the ASSS, in our area. Now, currently, I can tell you that Extra had a major impact on our organizational culture. Why? Because we used evidence based on research and best practices to design our programs and policies for our new institution. The other impact was the creation, following the participation in Extra, of a virtual knowledge management team. Moreover, this created eagerness to build interest for the program in order to submit a new team-based application for Cohort 12, although we are going through major change. And in fact, we feel in our organization and we feel that we can rely on senior management's support to build knowledge and skills. Now, as far as added value of Extra to our organization and to ourselves as fellows, we can say that the Extra program is truly a first-rate program. The teaching resources are specifically focused on developing leadership potential through concrete, meaningful, tangible projects. And as you said earlier, it's a pan-Canadian program and it's fully bilingual. The added value is to allow us to build extensive capacity in networking. And moreover, the staff guidance is consistent and truly top-notch. In terms of added value, furthermore, we could see skills development support through the expert advice provided by the coaches and mentors. Support to introduce new practices in participating organizations, including ours, was truly felt as well, and the ability to join a large community of practice and quick access to tools and knowledge online, directly on CFHI's website. Now, how did the program improve my own ability to lead? This is my personal ability to lead and my personal skills. I would say that it allowed me to recognize the program's reach, its resources, and also my personal opportunities afforded to me through Extra. It also helped me strengthen my regional network within our area in the Saguenay-Lac-Saint-Jean. It allowed me to develop new relationships and new alliances through the Extra network. I'm thinking of faculty, mentors, coaches, Extra staff, and of course, fellows from Quebec and across Canada. It allowed me as well to become aware of novel practices and ways to design healthcare assistance, and it allowed me to better assess my own ability to trigger and execute changes within my organization and within my system. As far as the impact of Extra on my own career or on my professional development, I would say that the Extra program turned into tangible support to advance my career in the midst of major change that I mentioned when I started my speech. Now, the Extra program also unlocked new opportunities and strengthened my ability to confidently make decisions regarding the organization of services. I feel I truly have the ability to influence the system. And I would say, in concluding, that a well-designed vision is a powerful lever to manage change. The Extra program helped me clarify my own vision and carve out a meaningful role for myself within the system and within the organization. I'd like to thank you for providing me this opportunity.
Thank you very much, Martine. Merci. We will now hear from Lynn Edwards. Please go ahead, Lynn.
And I hope everybody is enjoying a sunny day. And thank you for the opportunity to share my experience with the EXTRA program and CFHI with you. I'd like to start by just talking in general about the intervention initiative that we did as a team through our experience through EXTRA, and we developed a working together framework. While we were developing the working together framework, we were building our leadership and our understanding of evidence and how to apply it in a systematic way at the same time through the course, through the trajectory. So that's what will be expected through that EXTRA process, through the EXTRA program. The piece around evidence and organizational impact. In Nova Scotia, we've had over 18 people go through the EXTRA fellowship. And with that significant number of EXTRA fellows within the province, we know that we are having an impact on the organizational culture. So when we look at evidence, when we refer to evidence, it's been integrated into our culture. Well, we're focusing on, as I said, on an intervention intervention project. There have been multiple projects that have been done by the 18 fellows, and many of those have been sustained and spread across the province. I wanted to talk a little bit about quality and the impact on our quality agenda. The EXTRA program really does enhance one's ability to understand and apply the use of evidence through a quality lens, and we have seen that concurrently in our areas across the province from the teams that have participated in the EXTRA fellowship. And through my experience in the EXTRA fellowship, there's been that opportunity to bring that focus of quality back into our planning in the primary health care system. We've identified improvements to care delivery and focused on value for patients, concurrently continuing our focus on population health. Also within our organization, we have built a multi-year business planning process within our organization multi-year business planning process, which is based on evidence of best practices, and also informed by consultation with citizens. That's the experience we've had in one of our previous health authorities. And just now, I think I'll stop and explain that Nova Scotia has gone through a major transition as of April 1st of this year, moving from 9 health authorities to 1. So we'll continue to be able to support and spread the work that we've learned as EXTRA fellows across the province. And we know that we'll be adopting or hope to be adopting a business planning process that's consistent with evidence and being informed by engagement, which is critically important for our organization. The working through EXTRA has also allowed us to build those skills and competencies to develop decision-making frameworks for within our area and then across the organization. And also allowed us to focus on planning from a systems perspective. So not only are our EXTRA fellows current system executive leaders, but we're also emerging executive leaders of tomorrow. Our teams of fellows have included individuals with a variety of different trajectories in their careers. And so building the succession planning has been critically important, succession planning and a mentorship model through our teams. So one of the key benefits for the EXTRA fellowship, as I've been asked to speak to, has been the ability to build relationships and to make connections. And I echo what Martine has said about the opportunity to learn from fellows within the cohort and learn from work that's been done in previous cohorts through the desktop application. The building of those relationships provides a second level of insight into the health system delivery in the provinces across Canada, both the predominantly French-speaking and English-speaking provinces, which is extremely helpful. Not always, there's a way of learning, and one is through reading, and another is making those connections and building those relationships. The faculty has been phenomenal over the years. The experience that we've had with faculty, the speakers are second to none, and the mentors as well have been very focused on the improvement initiative that they've been linked very carefully with the specific improvement initiative that the fellows have been working on. The staff of CFHI have a can-do attitude, so they're there to support fellows in a first-rate way. Another key benefit of the spin-offs that we've experienced from our work through the extra fellowship has been involvement with the CFHI in various ways. So we've been involved in the Atlantic Healthcare Collaborative for Innovation Improvement in Chronic Disease, and that we feel has been a spin-off from having been involved in the extra fellowship, understanding the importance of participating in collaboratives and learning from others from across Canada. We also have been involved in, are fortunate to be in the partnering with patients and families for quality improvement, that national collaborative. And a further opportunity for myself and for our organization was to sponsor our last set of extra fellows who were successful in working together across Nova Scotia and Fraser Health in British Columbia on an initiative proactively delaying frailty in pre-seniors. So we've had an opportunity to have work within our provinces, spread across our province, across Atlantic Canada, and across Canada. So the next question that we were asked to speak to was around leading and sustaining change. And there was a huge opportunity to build my personal leadership style and skills and understand that and reflect on it during the time of the extra fellowship that was afforded to me, which is not always something that as professionals we have an opportunity to do. And we continue, we've built a team and a department community, and as I said, as one province now, we're spreading our improvements across our new health authority across the province and continue to build the culture based on leadership and evidence, which the extra fellows bring to their work every day. I've had the opportunity and continue to have the opportunity to mentor an awesome team that are dedicated, who are focused on building and spreading and sustaining appropriate change. And the change is associated with a cultural shift, which understands the importance of basing our information on what we're hearing from our patients or our citizens, and also from what best practices we learn about, both published and with our connections across Canada that we've formed through the extra fellowship. So I'm fortunate to be called into action as a leader and understand and see a direct connection between the extra fellowship experience, the leadership component of that, and the LEADS framework. From a career trajectory perspective, I've moved from Director of Primary Healthcare and Family Practice in one health authority to the Senior Director of Primary Healthcare, Family Practice and Chronic Disease for the province. And I'm not sure that's because of my good looks, but personality or good looks, but I would say I believe that working through the, having had the opportunity to build my capacity as a leader and understanding the culture change that's needed has helped to facilitate that change in my personal career. I've also had an opportunity to be a mentor for an extra team. So I went through the extra fellowship myself, and then a couple of years later, I've had that opportunity to be a mentor, and that's been terrific to reinforce both for myself and to be able to share with others that, that learning experience. And also there's been an opportunity for continuous learning for myself and for others, and that most recently has played itself out in having the opportunity to present and also learn from our colleagues in Denmark, Sweden, and Copenhagen. That was a phenomenal opportunity which was enhanced and supported by both research and CFHI connections. So not only do we become, have we built national connections, but we're now in the process of building international opportunities for sharing and learning. Thank you very much.
Thank you both for sharing with us today. Before we open up the questions to the audience, I would like to note that the deadline for receipt of applications from organizations is February 15th, 2016, and you can find all the relevant information, including the online application form, the extra prospectus, as well as information on former extra fellows on the CFHI website. And the link is provided on the slide. We have an initial question from Jean Evelyn. And so I'll start there in terms of taking questions from the audience. So please do feel free to submit your questions using the chat box at the bottom right of your screen, which several of you are already taking advantage of. So Jean has been asking, is there the possibility of submitting an organizational, one person from an organizational put forward an application and then CFHI would help to match them? In terms of, so Jean, I think if I understand your question correctly, and please feel free to chat if I'm missing the point, but we wouldn't accept a one-person application, an individual application. It does need to be an organizational level application, but that said, if you think you're interested in participating in the extra program, I would very much encourage you to call myself or Nick, and we can have a conversation and look for opportunities to create. We already, as you've heard from Lynn and Martine, there's an excellent cadre and network of fellows across the country in every province and territory. So we could certainly work with you to identify the possibility of a partnered application from multiple organizations. But an individual cannot submit; an organization has to submit, or several organizations together. In terms of other questions that we might have coming in, oh, thank you, perfect. I have some questions myself. Lynn, you were speaking really thoughtfully to the recent change in Nova Scotia, the merger into one health authority, and I'm wondering about what you see as the opportunity, taking the lesson, your experience from Extra, and delivering that at a systems level. So what's the opportunity for delivering, using Extra as a platform to build that not only organizational capacity, which certainly in the past Capital Health has done tremendously well, but now bringing that up to the next level of how does it influence and support system level improvement under the new Nova Scotia Health Authority?
So thank you for the question. There are many opportunities and strategies that we have used and will continue to use to do that. One being the development of a knowledge hub that happened as a result of the Extra Fellowship in one of the health authorities is now being spread province-wide to help reinforce the importance of evidence. The other is the new NSHA executive team are interested and will be sponsoring, or hopefully be sponsoring, if successful, a new cohort this year, which we hope will come from across various parts of the province and people in various roles, perhaps with other partners as well. So that's being worked on. The opportunity to be meeting and developing, we're doing some planning right now from I can talk about my part of the world from a primary health care perspective. We're going through the journey together, and those individuals who've been through an Extra Fellowship are having the opportunity to share their experiences with the use of evidence and how it's applied in developing a whole systems plan for primary health care in the province. So I'll leave it at that.
We have another question from Isabel, and I think I'll pass this to Martine. Martine, we're wondering about whether teams need to include a physician or not. So I can speak to the fact that it's not a requirement for any longer for teams to submit a physician, although we know that we need to have the right team in place. But Martine, can you speak to more globally the involvement in the composition of the team and the importance of getting the right players involved in the success of your improvement project and beyond?
Martine Couture, thanks for the question. So as you said, it's not a requirement as such to have a physician on board, but in our experience and for the future, I feel it's a winning condition to have a doctor on board for various reasons, to make sure that you'll work in partnership, to make sure that you can tap into collective management between clinical and administrative aspects of the business, and also to make sure that you have a champion within the team that can call upon other colleagues, whether they're GPs or specialists, so that we can co-build a change that will be suggested within the project. I think it's a winning condition at the end of the day to have a physician on your team. That's what we had in our improvement project within Cohort 10, and it was good for the project, but it was also good for the teamwork within the team itself and the region. So as far as I'm concerned, it would be a winning condition.
Thank you very much, Martine. We also have a question from Louise for Lynn in particular, and she's asking, what was your intervention that your project specifically focused on, and what were the goals of that improvement project? Lynn has already responded in the chat box feature, and she's saying that the specific intervention was the development of working together on a framework, and a framework that guided the interorganizational collective working together. I was not focusing on this specifically in the talk, so wanting to know now, Lynn, if you want to expand on further, giving some insight into your improvement project. And I'm repeating the question so our translators can do their job.
Thank you very much. So that's right, I didn't focus on that in the time that I had. I was part of a team of 3 individuals, a physician and one of my administrative colleagues, and we were at the time in our work with developing a primary health care system in one of the 9 health authorities as I've referred to. We were working with a lot of different organizations, both with and also organizational units within the larger, what was called Capital Health. And at that time we felt it was really critically important to understand how to work with others. So we developed our intervention initiative around building a working together framework that would guide ourselves and our teams to understand how we show up and to what level of working together we're seeking when we're developing common objectives and common outcomes for a specific initiative. So that working together framework is it is currently published. There is a toolkit that goes along with it, and it talks about communication through to and including collaboration and what the different characteristics that we identify that are critically important for each of those stages, and when to determine when you want to communicate with someone, you want to coordinate, or do you want to move fully to interorganizational collaboration. So that was our focused intervention project. Thank you.
Thank you very much, Lynn. Martine, I wonder if you could, since we have the time, could you give us some insight to your improvement project in particular?
Martine Couture. Yes, of course. So our improvement project was focused on assessing a program that was focused on chronic disease. We were looking at how people used healthcare if they were chronic disease patients. We were doing it in order to implement a broader program within the region, and in fact, within this assessment, we looked at a healthcare system that was a CSSS, a health and social services system, and we also looked at a family practice group to see what the potential was to implement an integrated chronic disease management approach. And we saw a few results within the project that allowed us to believe that there were improvements to make in order to align our practices and to implement an approach that could eventually be coordinated at the regional level. So essentially, as far as results goes, or outcomes, we looked at 2 cohorts of patients, and we got a better idea of their use of the services, but we also wanted to know what we needed to do to sustain our approach. That was the first part. Now, if you look at sustaining a project, it's important to introduce your project to various venues, and that's what we did. There was a provincial contest, and we were selected by the ministry, and through that we've managed to start integrating the approach to the whole of the region through the 11 family practice groups in our region. So we assessed a program that was already underway, and we came to various conclusions. We assessed what should be improved, and then we implemented a new intervention that was that addressed problems within the whole region. And currently, we're implementing the solution, the new approach, to the 11 family medicine groups.
Thank you very much, Martine. Given that we are making a change in the extra program this year and have moved toward an organizational application, I'm wondering if it would be, if both Lynn and Martine would be able to speak to the importance of organizational capacity and that senior management level support, that CEO and president level support, to enabling and ensuring the success of not only VIP, but in terms of the team's involvement and the benefit coming out of the program to build that organizational capacity. Can I first ask Lynn if you can speak to that, the importance of, and any challenges and how you might have overcome them in your project in particular in terms of securing and maintaining that senior level support throughout the program?
Oh, thank you for the question. In the particular intervention project and extra fellowship that I was involved in, we did not experience any challenges with this. The organization has had the experience of supporting 18 fellows, so really knew going into it what was expected of the organization. And I think that is a really important point to mention. There are expectations of the organization above and beyond the financial support. The importance of having senior leadership team give the time to the intervention and to the fellows, to give the time to mentor them from a leadership perspective, to open doors and make connections where that's necessary for the intervention project to be successful, and importantly for the spread of any initiatives. The flexibility within the roles of the individuals who will be involved, and we were looking at, as a physician, as a team member, what we do about compensating or supporting that individual if they're not in a contract mode. That's important for the organization. As I said, the overall ability to support the fellows for the time away from office that's necessary for this. And it ends up being a blend of fellows' time, both within their work and outside, and it's always really important to pick an intervention project that is aligned with the work that the fellows are currently involved in, and that allows that facilitates the integration of the work into the day or evening for that individual. So we did when I haven't had an experience in mentoring a extra team when the senior leadership perhaps didn't have a clear understanding of what the expectation of the initiative was, and that took a lot of discussions and a lot of support from the CFHI, and they're always there to support that, and also having a closer mentor to the having a current or a previous extra fellow to the team helped to mitigate some of those issues. So that would have been my experience. Corporate leadership is critically important, and I know that in our new Nova Scotia Health Authority, we definitely have that in our new CEO and team.
Thank you, Lynn. I'll now pass it over to Martine.
Martine Couture, thank you. As far as we're concerned, it was a first experience, and it was also the first experience of a team that was based on participants that belong to various levels of the organization. A CSSS, a Health and Social Services Center, a family medical group, and an agency. So myself, as the CEO, I was one of the fellows. So what that allowed me to see was that there was definite capacity to implement some decisions and a vision. So that's my personal experience as a leader. But if I think of senior leadership, I can tell you that through my own experience, I can tell you that that senior leadership support is absolutely essential. In our project, we worked with various stakeholders, and since I was already the CEO of the agency, it allowed me to meet the managing directors of the various organizations at a time when we had not yet merged. So I think, in closing, that it allows us to carry forward a vision and to become a lever for change or to sustain change that's already underway. And the fact that there are groups that are part of an organization that is supported by senior leadership, Lynn said so earlier, it allows us to build momentum for change and to build groups that become engines for this change. So that's my personal experience as a fellow and as a senior leader within an organization as well. Thank you.
Thank you very much, Martine. Since I'm not seeing any more questions coming in through the chat box, I think we're going to move forward into our closing. I would like to thank both Lynn and Martine for your excellent presentations today. We hope this session has been helpful in explaining the nature of the extra program and that the discussion will spark a dialogue within your organization about healthcare improvement and submitting an application. If you could please take a moment to fill out our quick polling survey, which you will now see on the screen. This will provide some useful information about where you see yourself in relation to the next steps to provided about applying to extra, including if you would like further information from CFHI. Thanks to all of you for attending the session and your participation in today's discussion. This concludes today's call.